Hey everybody, it's Dr. Cartwright. I want to take a moment to make this video for y'all to go over the vagal nerve exercises. And these are really important to help stimulate the parts of our brain that help our organs work. It's also going to help improve balance, coordination, and also stimulating these parts of the brain will help reduce chronic pain. Now guys, the first simple exercise we can do, we actually gargle some water, and that helps to stimulate the vagus nerve, which will then shoot down to the organs and help with blood flow and digestion and things like that. Now I'm going to show you an example of how I do it personally. So if we take a little cup of water, we're going to fill our mouth up, and then I'll show you how to do the gargling. If we do that breathing in and out while we gargle, if you do that, you want to do that about 2 minutes to get the full effect of the exercise. All right, now guys, the other simple exercise to do is when we brush our teeth, when we're done brushing our teeth, we're going to take the toothbrush, we're going to brush the back of the tongue to make ourselves gag 3 times. And making yourself gag, and not throw up, but make yourself gag a few times, that will help to stimulate, again, a few different cranial nerves, which is going to help with the brain, balance, and pain. Okay, now guys, the last exercise, we call it the yes, yes, no, no. And this is where we're doing head motions with our feet in certain position. So I'm going to break those down individually, and then I'll show you exactly how to do a full exercise. All right, now guys, the first thing to go over is there's going to be 3 different foot positions with this exercise. One is feet together. This will be the easiest one. Then we can do toe to heel one way or toe to heel the other way. Now, when we do the toe to heel one, this is where if you ever have any sort of balance deficiencies, it's going to show up during this. So later on in the video, I'm going to show a modified way of doing this so you can make sure you don't fall. All right, now guys, the other part of the exercise is what we call fixed eye position with head motions. So what I'm going to do here, I'm going to stare at the light switch across the room or the doorknob, something small where you can keep your eyes focused on that one thing. And we got 2 main head motions. One is up and down, like we're nodding yes, yes, right? So I'm going to keep my eyes fixated on something, and I look up and down like I'm nodding yes. Okay, and then the other one is my eyes stay fixated on an object, and I turn my head side to side like I'm shaking my head no. So again, we got yes, yes, and no, no. Okay. All right, now guys, the third part of the exercise, which sounds a little weird because it's functional neurology, is we're actually going to rub our earlobes like this as we hum the first verse to Happy Birthday. So, and to do the whole first verse of Happy Birthday. All right, now guys, I'm going to combine all 3 of those movements into the full exercise so you can see what it looks like. So I start with my feet together. I'm going to keep my eyes fixated on the other side of the room on something like a doorknob. I'm going to rub my earlobes. I'm going to look up and down as I hum Happy Birthday. Okay, that would be the first exercise. Now I can do the same thing with my feet together, side to side. That would be the next one. Now guys, once we do that full exercise with our feet together, then we can do same thing. Toe to heel, up and down, side to side, rubbing the earlobes, humming Happy Birthday. And then we can switch our feet to the other toe to heel and do the same thing over. All right, now guys, I want to show you some modifications in case you're having balance issues. One way to do this is to not worry about rubbing the earlobes, but you'll stand same with the feet together. We'll be in a doorway, and we still do the head motion up and down while we're humming Happy Birthday. And if you feel like you're getting off balance, you have the door frame here for you to help support you. And same thing, we can do the feet together, feet to toe to heel, or toe to heel.